My
Yes,
name
of
is
course.
Luisa Herrera. I founded Cultivating Tomorrow, which is an organization that both Andre and I are part of, and we are partnering this year with EPLN, and so we are sharing a little bit of our experiences within healthcare. I studied public health at Berkeley, so I finished my master's degree last summer, and now have my first year of work experience in a pharmaceutical company in Germany. And I will be speaking with Andre, so I'll let him introduce himself. Oh, I'll be the
Hi,
one.
everyone.
Sorry, one request. I'll say one more thing. I will be navigating the conversation and asking Andre about his experience. So, sorry, go ahead.
All right. Hi, everyone. I'm Andre Borrego. I'm a third-year medical student here at Foster School of Medicine in El Paso. It's a branch of Texas Tech. I'm from El Paso, born and raised, went to Eastwood High School, went to UTEP, and then went on to medical school here. I'm also getting a dual degree in public health through the UT Health. I've been a part of Cultivating Tomorrow since Luisa started it back in like 2018, when it was, mainly high school outreach. Now we've kind of grown and we've kind of, we were working in like providing some college material as well. And that's kind of how our partnership led us to EPLN.
Yeah. So today, like I said, we really wanted to have a spotlight on Andre and his med school education and his trajectory into where he is now and what that's led him. So Andre, could you provide us a little bit of an overview of your education background from undergrad until, I mean, you kind of said it, right? You've been to from now, but a little bit more into detail, I would say,
Yeah,
like what you
absolutely.
studied.
So around high school, I kind of started getting interested in medicine. Didn't really know how to go about it. I'm the first one in my family that's pursuing a degree like this. My cousin just so happened to be starting at the same time as me, so we were both figuring it out together. And I just knew that I liked medicine, didn't know how to go about it. So I kind of talked to my college advisors in high school. They told me, like usually people do their pre-med degree and they usually study biology. So we would recommend you do that. And that's around the time that I was applying to college. So I went to UTEP. I originally started in majoring in biology. I found it very boring. I didn't really find it the thing that I liked. But that's around the time that I found molecular biochemistry. So I shifted to that, which still covers all the prerequisites you need for medicine. It just so happened that it was more interesting to me. However, there is multiple paths you can take. And then in college, I started doing some research. My microbiology professor was doing some HIV research at the molecular level. So I got to participate in that, did about 3 years with that. And then around that time, since I was doing so much research, I applied for scholarships for research. And I was actually being paid to do research for the university while also receiving part of my tuition covered. And then around the time of COVID hit, I was like studying for my MCAT, decided to take a gap year, which it just so happened to fall during that COVID year, which really worked out because I got to not go into a really difficult degree in the middle of a very crazy pandemic. And then because of the pandemic, I found like public health to be a little bit more interesting, and I really wanted to be partaking more in it, which is why around the time that I was applying to med school, I was like, well, what schools offer a dual degree? And that's when I found that Foster does offer that as well. So I dual applied.
That's great. Thank you for that. So I wanted to touch base on a couple of things that you mentioned. So you said that you first started your bachelor's from your undergrad at UTEP doing biology, and you then switched to molecular chemistry. As a doctor, and then you also talked about these pre-med recs, right? So I wanted to dive a little bit more into that and what people considering to become a doctor, an MD in particular, not any doctor, an MD, need to have a base in the US. Because I know, for example, in other countries, you can study medicine since your bachelor's and then finish up when you go into med school. Like you do your bachelor's with a MD, I'm not like an MD, but like you're doing a bachelor's in medicine, you could say.
Yeah.
And then you go into medical school. And sometimes the trajectory is a little bit less, it's 6 years. So how does it work in the US? What are these prereqs that you're talking about, and how much play around do you have as a bachelor student?
So yeah, like you were saying, it is different in every country. Um, Mexico, our sister country, has a 6-year degree that you kind of go into right out of high school. However, in the United States, the way that it is done, you have to get certain prerequisite courses and a bachelor's. You can't just fill out your prerequisites and go on to medical school. You will
Mm-hmm.
have to get a bachelor's degree. The prerequisite courses, for the most part, are biology 1, biology 2, chemistry 1, chemistry 2, organic chemistry, biochemistry, statistics, um, genetics, and I think one other higher level math. And that really covers everything that you need. So knowing that, it may seem like a lot of courses, but in reality, I have friends in my medical school who did engineering, who did
Mm-hmm.
social work. There is a lot of majors. You are not limited to only biology or biochemistry like I did. There's a lot of options. You really can pursue whatever you want in undergrad and then still pursue your medical degree.
Okay, great. Thank you for that. And then another thing, which is fun, right? Like that means that like if your heart is in medicine and at the end of the day you would like to become a doctor and kind of have that in the community, I would see that as a benefit in the US that I mean, if you are also passionate about art, you could have an art degree and then also pursue
Hmm.
and get those prereqs and make your way into med school. Obviously, you have to, at the end of the day, have a resume that is competitive enough to get into med school, but not impossible, I would say.
Yeah,
So you
and
can correct
having
me wrong.
diverse backgrounds really helps in medicine. Coming
Mhm.
from different places uh, helps you sympathize with your patients better, helps you, understand where they're coming from as well. And it also lets you see medicine from a different perspective because there is a lot of perspectives to medicine.
Exactly. And so can you tell us, you also said that throughout this time you took a gap year. Why did you take that gap year?
So my gap year wasn't fully intentional, but it also was intentional. So I took my first MCAT back in my junior year of college, which is kind of the recommended if you're trying to go straight into medical school, no gap year. I did not like my score. So I was like, okay, maybe this isn't the year I apply. Maybe a gap year
Mhm.
actually does sound good. And um, I I personally suggest the gap year because it is a big step, not having a full summer because medical school starts in June. You usually graduate in like late June or July, and usually graduate in May. Um, so it gives you really some time to unwind, enjoy life a little bit, travel, experience some other things. I became a barista during my gap year. I love coffee. I got to experience something different. Um, so yeah, my senior year, I took my MCAT again, filled out the full
Mhm.
application this time, and that process kind of starts around Mayish is the earliest you can submit your early application for Texas. Early applications for the rest of the nation, which is MCAS, a different application that I can go into
Mm.
more if you guys want, opens up in June. And you can early apply to both of those. And the earlier you apply, the better your chances are of getting into medical school. So, I had more time to work on it.
Okay. So that you said for your application process usually starts like, let's say your goal is to start fall 2023 med school. You had to send your application or start looking into these applications in June 2022. So almost
Correct.
a year and a half before.
Yeah. So it really is, like a pretty big commitment. Because kind of that full year does fill up with medical stuff. So say you send in your application right as soon as early applications open for Texas and you submitted it in May, you already have your letters of recommendation. You already have your personal statement. You know what hobbies you want to talk about. Um, I'm trying to think what else you might need. Uh, just other experiences like volunteering. You've calculated all your hours already. You
Mm-hmm.
submit that, and then around June, uh, no, July is when interviews already start. So actually, just this Thursday, I already participated in an interview panel for the class that's already applying for this
The following
fall of 2024.
fall.
So
Yeah.
it is
That's
they call it
crazy.
rolling admissions. What that
Uh-huh.
means is they have set amount of spots. So our school does about 126 students. Those 126 students start getting filled up, and kind of the closer you get towards the end, they're a little bit pickier they get. They're like,
Yeah,
well,
that makes
we
sense.
have these people with like all these same GPAs, but this person
Hmm.
volunteered a lot more, did a lot more with the community, so they can start getting a little bit more selective because they don't have
Okay.
as many open spots.
Yeah, that makes sense. I did not know that. And I definitely, and I think that your advice is quite, I would agree to it, or at least I think it's quite beneficial was beneficial for, could see it beneficial based on my experience coming from a different, not pursuing MD, but pursuing like post-grad education, right? That I feel like your last year of your bachelor's is filled with like, and projects and all these different things that you have to wrap up. Like you are not only moving on into potential like med school or post-grad program, but you're also finishing up your bachelor's degree. And that's a big
Mhm.
deal, right?
Yeah.
Like there's a lot of things that come into it. You also want to, I don't know, at least for me, I moved to a different city and my friends were moving. So I wanted to spend time with them and enjoy. At the time I was in Austin, UT Austin. So like trying to savor of like, wow, this might be the last time that I'm living in this city and experiencing this city. But I also have to like either find a job or fill out these projects and applications. And so kind of, I think this, like you said, this gap year allows you to like slow down and kind of savor that last year, be more
Yes.
present in that last year, not rush into a decision that you might think you need to make because people around you are making them. And then the other thing too is in that grad, I mean, you said it yourself that you were able to find new hobbies that you might have not found if you just kind of like rushed into going into your program, because that's also the struggles of post-grad degrees. They're full time and you're not getting this like 3 month nice break that you were once getting in your bachelor's degree or when you were in the
Mhm.
third grade. Like that's gone, that's out the door. Once you
Yeah.
get your bachelor's, post-grad degrees are full time. Like you have a week maybe off of summer break and then you keep going, and summer
Exactly.
breaks are full time as well. So um I think like slowing down and having that uh year gap is quite a good opportunity, because then like you said, you were able to provide more quality applications as well and meet them earlier so that you can kind of like play with the system that uh accepts students as they come.
Hmm.
My next kind of thing that I wanted to go into, so there is kind of like a huge need for healthcare providers, and we saw that during the pandemic. There's also a huge, I feel like because school is getting so expensive and people are seeing that they really don't need school to make money, right? That might not think of like, why do I need to go to school? School is really not necessary, right? But at the end of the day, it's like, we need healthcare providers, like we need engineers, we need, like as like obviously I'm complete pro game of like not everybody needs to go to uni. There's not one way path, but I should not. I'm also like, please let's not have this conversation of like forget college. Like I'm
Yeah.
like, I know it's so expensive, and I know healthcare can be hard, and now I'm sure like being a healthcare provider comes with a lot of uh things that you have to give up, and you can talk about that. What would you tell a student that's kind of like thinking about pursuing medicine but is probably 16, 17, 18, and is kind of disappointed, one, at the cost of college, and like
Hmm.
also at these like at the system that is probably against them, right? And also at the length that it takes to pursue medicine. I just not to corner you, but
No,
but
yeah, no, you're good. It is tough. I have kind of come to realize that medicine, at least at the doctorate level, like an MD or a doctor of osteopathic medicine, which is a very similar route to MD,
mhm,
and they're the ones that are practicing, and they're the ones that are considering the supervising doctors in all hospitals. They you you have to really love it. You have to absolutely not see yourself doing anything else, because I honestly live by this advice. If you can see yourself doing something else, consider it, take a gander at it. Um, I personally could not see myself doing anything other than medicine. And that
mhm,
has really helped me, like stay with it. And there's a lot of hard days, there is a lot of sacrifice, as you were saying, there's a lot that you will have to give up. Even during college, in undergrad, you will, have to sometimes prioritize going to your research lab and, really finishing that experiment, because that's kind of what is required to get into medical school. There's still time for fun. And I love my cohort. My cohort in medical school is amazing. We get along super well. And even in medical school, it's not like we're only studying. We have a pretty good balance. Last year, 20 of us went to Cancun, there's still time to enjoy ourselves. And I think, medicine is honestly beautiful. The first 2 years of our curriculum requires us to be, mainly book-based. So we're mainly learning the basics, the sciences, the pathologies, how certain diseases work, at like how it presents on a human, like at the big level, like, when you see your rash come on, but also like at the molecular level, like what is going on inside of the cells that are responding to cause you to have hives. And that is cool in a way, but third year, where I've like now been in the hospital, it's amazing. Like my first few weeks I was delivering babies, and it's like, you really are like the first few hands that hold that baby as it came to life. And then I went to nursery, and yeah, it's extremely, you are doing something, you are really impacting people's lives, like from the beginning. And then I did surgery afterwards, and I got to, like work in the trauma bay, where people come in like the worst situation, like, someone was just in a car accident, they're completely unconscious, and your job is to make sure that they are able to become conscious again. They make sure that they're gonna, continue to be able to go back home. And it's like, there is a wide dynamic of medicine. It's very happy moments and very sad moments. But it really lets you experience a lot. And I think it's a beautiful career for that. And, like you are the responsible one. Like as a physician, you are the one that's like making the decisions, you're leading the team. And I think to be granted that responsibility and that opportunity, I think it's amazing. And you're combining like all your knowledge from undergrad, like all this molecular knowledge that you may actually think like, why am I learning this in college? And then you are presented with it, and it's like you need to kind of apply it to a degree. It's not like 100% that you need it, but it helps your decision making. And I think just like being able to combine all that, it's a very unique career because of it.
Yeah. So here, Andre, if you're discerning it, if you're thinking about it, really give it a good thought and not just be discouraged by some barriers that you might think are not there.
Let me talk a little bit about the financials too, because I completely forgot that part. I completely forgot it because it's kind of easy to overlook it. There is a lot of resources to help you. There's not a lot of scholarships. So for example, undergrad, I think it's a little bit easier to go with scholarships. It's easier to apply because there's more undergraduate scholarships. There's more financial aid, like grants that don't have to be paid back at all. And then loans, by and large, in undergrad are unsubsidized. So you don't have to start paying interest yet till you get to your next step, which is graduate school or professional school. In medical school, you do acquire more debt. And I think for the most part, it's inevitable to get debt from medical school, which definitely is a barrier. Like I think the average medical school debt is in the 220,000s, which sounds daunting. It's like, that is so much money.
It was 220. Yeah.
I have that fact memorized.
It's crazy. Yeah. Each year it's like close to 60K, 57.
So something good about Texas is that average is extremely lower. Texas has the cheapest medical school costs of any other state, and they love Texans. So Texas, 90% of any Texas public school has to have Texas students. So 90% of that class has to be from Texas. The other 10%, they can pick wherever they want. But Texas wants to increase its physicians, providers that are staying in Texas. So they recruit Texans.
That's good to know.
That debt is the debt is a lot. But it's also one of those careers that after residency is the part that comes right after medical school. after residency, you can start making really decent money. That puts you in a great path to pay that off within 10 years. And there is a lot of programs that if you serve it in underserved communities, El Paso is considered an underserved community. The government helps you pay off your loans because you are helping a community in need. Because like you said, there is a need of providers. So you're helping fulfill that need, and you're like, El Paso, I've seen it. Like, we need physicians of all types. We have not as many specialists as we need. We don't have that many primary care physicians either.
Yeah, exactly. And like you, oh my gosh, you said so many things. So
I'm so sorry.
Like you said, no, but I love everything that you're saying. So I'm kind of like, yes. I do think it can be discouraging, and like you said, like the price tag is quite big. And so sometimes, I mean, at least for me, if you would have told me that at 18, 220K, I would have been like, no, there's no way. Like, it's just like, I would completely just like walked away in the room and not have listened to anything that you said, right? But I think that's also the thing about like why Cultivating Tomorrow or EPLN exist in the community, right? Because it's a place for us to have these conversations, acknowledge the big elephant in the room, right? And if we do think like, that there's better ways so that we can have, like I said, we need doctors, we need specialists, like our community cannot live without them. What are better ways to come together to think about and to kind of like navigate the conversation and potentially change policy or communicate with our college universities to say, hey, you know what, med students, they need scholarships too. You want first generation.
There is like our community, El Paso. I was lucky enough to receive a scholarship for medical school, which it is a little bit hard to find those. Sometimes though, you get lucky, and I received a scholarship through the Rotary Club of El Paso, and in a lot of cities, there is like community members that want to help medical students for that same reason. There's a big need, and yeah, it is daunting to find out about it very early on, how much you'll be in debt. I was lucky enough that I was ignorant at the time and I had no idea how much it was going to cost me. I think it would have been a lot scarier had I known. I'm really glad I didn't, because I don't see myself doing anything else. And I would hate for the money to be the reason why I don't want to do it. There's even in El Paso, so there's a coffee shop here run by a graduate student at Texas Tech that provides grants to people who are applying to medical school, because that is another thing. You need to pay to apply to medical school, and each application you send out costs money. But there is resources in El Paso to help those students fill out that application and pursue their dreams.
Exactly. Yeah, and that's good. That's why, like I said, it's good that we kind of have these platforms so that we kind of like share with the community, like there are resources, it does exist, and if there isn't, then let's talk about it so that we know, and let's find ways to try to find these gaps so that we are supportive. Because I don't know, I've been to the hospital with my parents, and even when I was younger, like having to translate, right? So it's just like, imagine how cool it would have been that I saw a doctor that looked like me or spoke like me and had more conversations, when a lot of the times in my own community, I felt like my parents were not being heard. And so,
and I've seen like a lot of residents here that they want so hard to be able to connect with that patient, but they have that language barrier, and they've worked on their Spanish, but they know that their Spanish is not. If they work on their Spanish with that patient, they're not going to do that patient justice. So they have to bring an interpreter, which does kind of affect that patient dynamic. I'm fortunate enough that I'm very fluent in Spanish, and I can now like do these encounters on my own with these patients, and the doctors can trust me that I'm asking the right questions. So like you said, it is great to have someone that looks like the patient, who can connect with the patient.
Exactly. Yeah, and especially because it's like, one thing is the language, right? But it's also further than that. I think medicine goes beyond that, and we'll get into the public health aspect of that too.
Yeah.
But it's just like, you understand the dynamic at home, you understand the type of like lifestyle that they're having, their access to groceries, if they're actually going to the doctor, the boundaries that they might have to access to healthcare. And so you walk into the room and you already kind of have more things than a doctor might take 4 or 5 weeks to figure out, because you're able to kind of connect. So that leads me to my next question. What has it been like to serve the community of El Paso? What has it taught you? And you've mentioned that we have needs in the sense of we need more experts, or what did you say?
Specialists.
There you go.
Yes.
Specialist. What other
Yeah,
gaps do you see that it needs? But go ahead.
I kind of started working with the community since I started volunteering at the Baptist Clinic, which is a free clinic here in El Paso that I actually started volunteering there around 2018 as well. And you got to see really like the needs of people who have no insurance. So this clinic is pretty much for uninsured members of the community. And you know, there is a lot of high blood pressure in El Paso. There's a lot of diabetes, and there is a social aspect, but also a genetic aspect to it. So Hispanics genetically are more predisposed to have diabetes or hypertension, which is high blood pressure. And it is easy if you don't have regular medical care to have that go uncontrolled. And when these things go uncontrolled, they cause a lot more problems, like heart problems. Your vision changes. You might lose a foot from diabetes because you're not managing your sugar, so you can't feel anything, and you don't feel that one cut that's under your leg. And because you don't have enough circulation, your foot can't clear that infection early. So now you have a crazy bad infection on your foot that does require amputation. So there is a lot of crossover, like literally, like we have a lot of people who go to Juarez, go get treatments, and are also being managed here. So that is one thing. So like you have to keep aware, like, all right, what are they taking that we gave them, and what are they taking that Juarez gave them?
Yeah.
And how can we work together? And like, no, grandmas love their home remedies, and you're not going to change that from Hispanics. We love to treat, you know, with like the manzanilla and the arnica, and there is ways to incorporate them. So it's yeah, you know, give them the huevo, make sure that it's like la limpia and everything. And it's like great because at our med school we are taught that how to incorporate both of them, because it's not necessarily wrong what they're doing. And even if there's no scientific evidence that it works, there is always a placebo, and there's always, you know, if it's not causing any harm and it's helping that patient, why take that away from them? So we let it go. But
yeah, but it's important to the patient, right?
Yeah, and it you got to connect with the patient. You gotta, it's a two-way relationship. It's so medicine has changed from a paternal perspective where I, the doctor, tell the patient you need to take this. Now it's like, all right, what is your goal as a patient? Because like, yes, you have diabetes, but there are some changes you will not make. And if I keep pushing you on those changes, you're not even going to pay attention to me. So let's compromise. Let's work together to arrive at, you're going to give something, I'll give something, and we can treat your diabetes the best we can. So it's more like a collaborative perspective now, and we're really trying to change that. And I think with this population, it really works. It really helps, and they're so thankful. Like our population is extremely helpful, like thankful when you can help them, because it's like, and there's a lot of education that's involved. Like there's a lot of things that we try that can be harmful to us. Like I think my dad's responsible of it too. Like he'll feel a sore throat and he's like, oh my gosh, I have an infection. I need to go get some antibiotics. And it's not the case. Most sore throats are viral, and antibiotics cannot treat viral infections. So educating them, like, hey, let's actually, just keep hydrating. We'll give you something for your sore throat, like some symptomatic treatment, and you're gonna feel fine in just the same amount of days as if you had received that antibiotic shot. So if you educate them, you prevent antibiotic resistance, which is a huge problem in the medical community as well.
Exactly. Yeah, that's quite scary as well. Now we kind of, I think that's also a good way to transition into one of the fun parts of, or I think it's one of the fun parts of the interview, which is the intersection of public health and medicine. And here you're talking about how before medicine was more this like paternal figure of like, I tell you what to do, and now it's kind of like, okay, what is your end goal as as a patient, right? So now if we take like 3 steps back, so I studied public health. The difference between public health is, one, public health, you prevent disease from happening, right? You work whether, I mean, it's different, you can work in so many different ways. You can do like gun control, you can talk about like people taking like the right medication so that they don't overdose, for example. And you work with the city to take care of the water, or you could work with a pharmaceutical company so that it's working things are working properly and people are actually getting the right medication where it needs to go and delivered equitably, right? So it's more like the background of the management of
Yeah.
health. And then when you go into medicine, it's more like something already has happened, and there needs to be an intervention, and the care compared to public health, it's not at the population level, but it's usually on, like, you have a patient in front of you and you kind of need to have the tools to kind of provide the best care and try to find the best solutions. So my question to you is, why do you think it's important that you as an MD has a background in public health?
Yeah. So I think one of the things that I take pride in and I feel very privileged to be able to have is, I think my medical knowledge extends from like a molecular level, like my undergrad degree. I was working with molecules and like seeing how proteins interact with each other to affect health. And now I'm looking at, in my medical degree, I'm looking at how health develops in a patient. And so I also have now the public health aspect of it. So I really think I go from very small to really big picture. And I think they all cross over. They're all very important to have at least a small foundation in. I love prevention. Preventative medicine, I think, is, and it's good because medicine really wants to achieve that. We really want to be like, all right, let's, before you even develop hypertension, before you even develop diabetes, let's start making changes so that this doesn't happen. And like you were talking, there's you can treat the disease, which is what a lot of medicine has been up until now, or you can prevent the disease, like the upstream and the downstream. And even, okay, you develop diabetes, there's still things we can prevent, like secondary prevention and tertiary prevention, where we're making sure that, like, okay, your diabetes, you're not going to lose your foot, because we have all this research that has, like, all this public health research that knows that the best thing we can do for you now is maintain your sugars, maintain your diet. And if we achieve those goals, the likelihood of you progressing to a much worse stage of diabetes are very unlikely. But public health policy, which is one of the things that I like the most, is kind of how you make that happen. And you do have to work with your governments and your like public health leaders and your physicians all have to work together to be like, all right, what is our goal? What do we want to change in the community? And also talk to the community to see what they want. I think needs assessments, I love needs assessments. Like, what is the community actually need? What do they think they need? Because it's easy for us to identify problems. We have a lot of data, but also the community needs to know what they want to change. I don't know if you've heard of the Tom's shoes problem. What happened with the Tom's shoes? Yes, I think that's a great example of why you need to do a needs assessment.
Yeah, thank you for that. Yeah, I agree. I think there's both public health and doctor, like healthcare providers, need to speak to each other, right? And I think that's also the importance of it. And also the beauty of like somebody, for example, right now that might be too young and kind of is struggling, or might be first gen that is still like, oh my gosh, what are they talking about? There's so many different things. I think there's not only one way to serve the community, right? Which is quite awesome in healthcare. And there's also multiple ways of doing it the way that you're doing it, right? Whether you get this MD, but also work in public health. And then another thing that I would tell the first gen, like, yes, Andre is about to get his MD, and yes, he might pursue medicine in a couple of years, but now that he has a public health degree, or even just with his MD, doesn't mean that he can't work in an office, right? Doesn't mean he can't create policy. That doesn't mean that his life is just in a hospital for the rest of his life. If he wants to,
MD
Yeah,
opens up so many
it
opportunities,
opens so
and so
many
does a public
doors.
health degree. It's like, I mean, I could become an astronaut if I wanted to. There is
Yeah.
astronauts that have MDs because, medicine affects everything, and uh, it it really helps you have this foundation. It is a really hard foundation to achieve because there's so much knowledge that gets incorporated into it. But again, it's a nice privilege to have.
Mm-hmm. Exactly. I think with that, that was well, we can wrap up the conversation for today. I think it was quite you provided a lot of your insights, so thank you for taking the time to open up and share your experiences. I hope that it's helpful for the community, and we can continue to have these open spaces so that people can learn.
Yes. Thank you so much,
So
Lisa.
thank you, Andre. Bye bye. Speak soon.
Bye bye.